Welcome, hello, welcome to another Move with Ease. So I'm Caroline from Yoga Nut, a clinical massage therapist and a yoga blended with slings, my fascial training teacher. So I'm spending much more time typing. I don't know about you. So I thought that this focus would be really good to look at the movement of the wrist and put in some lovely stretches and some self-massage techniques for you. So the first thing I want us to do is just look at the movement of the wrist, and this in itself is lovely to do, just kind of like you're knocking on the door, just bringing the fists forwards and backwards. And I've got a lovely little click going on in my right wrist, my dominant side. No pain though. So like any movement that you do, don't move into pain, just, you know, go up to the edge and then move back a little bit from pain. And then we can do this movement. Little finger draws in and thumb draws out. So that's another movement that we don't consciously do very much. I would be doing this if I were working with a client in clinical massage. Lovely, so I'll be massaging and I'll get them to do these sorts of movements to release the tissue. So let's put in a lovely stretch. This is really focusing on the superficial front line and the lateral line, those of you that are aware of anatomy trains, Thomas Myers anatomy trains. So what I'd like you to do, I'll just scoot back a little bit on my ball. So with your left hand, make a fist, and the thumb can be either inside the fingers or outside. You're going to make a fist, and then you're going to draw the fist in towards the fleshy part of the forearm and just feel that tensioning. So I want you to keep your arm hanging down, shoulders nice and relaxed. I'm just going to change my position so that you can see. So we're tensioning the front of the forearm, so that's engaging. So now what I'd like you to do is bend the elbow. So we're now tensioning the upper arm. So we've got the fist in, we're tensioning the forearm, and the hairy side of the forearm's getting a stretch. We've now engaged the biceps. Now what I'd like you to do is lift the elbow up. And now what we're starting to do is we're getting deeper into the superficial front line by engaging or stretching through the latissimus dorsi, which is connected to the thoracolumbar fascia. So now what I'd like you to do is really reach the arm up, but keep that wrist flexion. Lovely. Now think about, I'll just move my hair out of the way, the top of the ear as well as the fist, and it lifts you up, but keep that arm bone in the shoulder socket, lifts you up to stretch you over. So don't think about making kind of a C shape with the waist. Lift up through the ear, lift up through the wrist, but keep the arm bone down. Don't draw the arm backwards. Keep it so that you can see it in your vision. Lovely. So starting to open up through the side body. Lovely, creating space. You've got that tensioning in the wrist. Now what I'd like you to do is release the fingers. Release the wrist. Just notice how you feel. Keep that upward lift from the ear. Turn the palm away and start to lower the arm. Keep lifting up in the ear. So what you might feel at some point, so for me now, I'm getting a lovely stretch, like a neural stretch down my arm. Relax the fingers, keep the ear lifting up, and you can hold this stretch. Your arm might be up here to feel that stretch, it might be lower down. And then release as the arm comes down to the side, it brings the head up. So let's do that to the other side. So your right side, arm hangs down, you're nice and relaxed, you've got that upward lift from your posture. So what I want you to do is you keep the arm hanging down. So I'm just moving my arm so I can show you. You make a fist and the thumb stays on the outside, or you tuck it on the inside. Now from that fist, draw the fist into the fleshy part of the forearm. Keep that arm down, lovely. So we're tensioning through the front of the forearm. Now you're going to bend the elbow And we're tensioning, contracting through the bicep muscles, therefore lengthening the tricep muscles, lengthening through the hairy side of the forearm. And now what I want you to do is arc the elbow up. Lovely. And then actively lengthen the arm, but keeping that wrist flexed. Brilliant. Keep the arm in front of you, don't draw it back. Think about lifting up from the ear, crown of the head and the ear, and that fist. You lengthen up, but keep that arm bone down, and you lengthen to come into a side stretch. So we're stretching through the latissimus dorsi, so activating that, lengthening through the lateral line, but we've got this tensioning going on in the wrist and the forearm. And if you wanted to, you could move the wrist, and that really creates more tension for me. Quite nice though. Then come to stillness. Now open through the hand, open through the fingers. Lovely. Now keep that lift from the crown of the head into that side body. Turn the palm away. Start to lower the arm. Keep that lift in the ear and wait until you find a stretch. So for me, it's higher up on this side. So there's that lengthening but plugging in the arm bone and the lifting up from the ear. So we're coming into the side of the neck, scaling muscles amongst others. And then slowly lower that arm down, and the lowering of the arm brings the head up. Lovely. Just notice how that feels in both arms. So for me, my arms feel longer. There's much more space, especially around the wrist and the hand, and the inside of my palm. It actually feels like I'm kind of holding some balls. Really unusual, but very, very pleasant indeed. So let's go back to those movements. So we've tensioned through this area. So let's think about putting a stretch now into this side. So we can do a static stretch. So if you raise your arm but keep the shoulders nice and relaxed, I'm just kind of changing my position so that you can see my hand more clearly. And you're going to draw the fingers back towards the hairy part of the forearm. Now, you can gently put in a little bit of pressure. Do keep soft in the neck, keep soft in the shoulders. And you can hold this lovely static stretch for maybe 30 seconds. And you'll get that lovely stretch. You'll be able to feel it all the way up into your shoulders. So that just gentle pressure, lovely. Now, if we wanted to take that into a more active stretch, where we're stretching this side of the arm, contracting this side of the arm, but actually making it quite cardiovascular, what we do is, that's a nice resting neutral position for the wrist. So that's what I want you to do. Now draw the back of the hand towards the hairy part of the wrist. Gently pull the hand back, 2 seconds, and release. Hand pulls back, you increase stretch, 1, 2, you release. Just soften through the shoulder. I can see my shoulder lifting. Don't lock the elbow joint. We do this 10 times, neutral position, stretch, increase stretch, release. Stretch, increase stretch, 2 seconds. So you'll feel the fleshy part of the forearm stretching whilst the hairy part of the forearm is contracting. So when you've done your 10, rest the arms down. Notice how you feel. So I've got a bit of tensioning actually in my shoulder from raising the arm. So I'm gonna, maybe if I weren't on camera, I'd have my arm lower. But again, that really big space that I've created around the wrist and the forearm and in the hands. So now let's do that. You're gonna do that to your left hand. So raise the arm, but keep the shoulder nice and relaxed. We'll do that static stretch, so the fingers move back towards the hairy part of the forearm. And you just put in a deeper stretch. So it's, don't move into pain at all. Don't lock through the elbow. We're increasing the stretch, so it's a nice static stretch into the fleshy part of the forearm, while the hairy part of the forearm's contracting. Hold this for 15 to 30 seconds. And then we can move into that more active stretch. So you've got that relaxed position. You then engage the hairy part of the forearm, and then you increase the stretch by pulling the hand back for 2 seconds. Remember, the word pull sometimes means that you can create pain. Don't create pain, just increase the stretch. So drop the shoulder down, remember. So I can see myself on camera, but I want you to see this movement. So you might have your arm way lower so that you don't tension in the neck and in the shoulder. So relaxed, engaged, increased stretch, soften. So you contract, you stretch, you soften. Do that for 10 times. You can do this. This around is maybe 10 times. You can do that another time if you want to. If you're watching live, you can't pause me, but if you're watching the replay, you can pause me and do that another time. So just let the arms hang. So we've done 2 exercises, but obviously we've got two sides. Just feel kind of the neural pathways down the arms, that kind of sense of space and length that we've created. So we've done some stretches, which is just kind of lovely. I feel much freer. What we could do now, we started with looking at the movements of the wrist. So that knocking on the door movement, do that a few times and just see whether you can sense a change. So my right side's still tighter, but I'm right dominant. And then soft fingers, you could do that in fists as well if you wanted to. And just see a little wave with the wrists, not with the elbows or the arms, just with the wrists. Lovely. And again, let the arms hang, just get that sense of opening and space that you've created in the forearms especially, and in the wrists. So just to close, let's do a bit of massage. So if you have the thumb facing up, just use the heel of the hand and your fingers and never kind of compress strongly. If you find that you're gritting your teeth and you're going way overboard, just really soft. So just imagine that thumb side of the forearm in between, and you're just going to softly compress. So start at the thumb and just squeeze. It's like just a gentle squeezing, and just move all the way up to the elbow. And then you can come back down. So really lovely. And then we're going to add in a bit of movement. So when you squeeze, move the thumb down and then release. Squeeze, move the thumb down. So you can do a bolder movement if you want to. And you don't have to be in time with the squeeze. You can keep that movement, or you could squeeze and then move the thumb away. And that is a lock of the tissues and then a stretch to the tissues. So that's quite nice if you can get that coordination, that rhythm going. Lovely. And so we'll do that to the other side. So again, I'm raising my arm more just so that you can see me in this sunlit orange room. My blinds are orange, so I always look orange. I don't use fake tan, I'm very pasty actually. So again, just squeeze, gently squeeze. You know, you're not kind of doing anything to hurt you. It should just feel really nice, and you're not over tensioning the working hand either. Lovely. So with that squeeze, move the thumb away, release. Compress, move the thumb away. Compress, move the thumb away. Compress, move the thumb away. So in clinical massage therapy, we do things like this, but I don't know if you can feel in between the heel of the hand, there's septums, there's gaps between muscles. There aren't really any gaps because of the fascial body, but we get into the septa and it's about creating space. So this sort of thing is great if you've got tennis elbow or golfer's elbow. So in clinical massage, we'll be working the whole chain of the arm up into the neck, because scalenes can refer down into arm pain. So that's really lovely. Now, one final one is you might need a little bit of oil, like some coconut oil, but don't over kind of lubricate the forearm. Again, I'm lifting my arm up just so that you can see me. Is you use that grip again with the heel of the hand and the fingers, and you move the wrist like this, and you just start to feed up towards the elbow. So it might be that you want to use thumb and fingers, and there's a glide. So it's quite hot in here, so I'm a bit sweaty. So I'm gliding, all right. You just glide up to the bone. Now what you can do again is you add that movement as you glide. It's lovely. You can come off, re-grip, glide again. So I use the word grip again. It's not over tensioning. It just should feel really, really lovely. You can do this at any time, you know. I would be saying if you're an office worker, you know, if you're, well, actually you don't need to be an office worker. If you're doing lots of typing, lots of computer work, you know, space it out. Do a block of 30 minutes, move away and do these sort of stretches, you know, take a walk, make a cup of tea, that sort of thing. Because form follows function, as Moo from Sling's Art of Motion says, and it's very, very true. Form follows function. If you overuse in an area, it gets tense. So it's this sort of thing that can help to release it. Movement, massage therapy. Oh, well, I hope you enjoyed that. If this raises any questions, then, you know, you can post them now and I'll do my best to answer them, of course. But, you know, do contact me at any time. I will get back to you and hopefully give you a, you know, a positive, helpful answer. So enjoy the rest of your week, and remember, take breaks from your computer. Bye now.